Hi guys, this is Carlos. I'm here to talk about hypertension and how the nursing process has an influence in it. Just a quick reminder that the nursing process consists of assessment, planning, implementation, and evaluation. When we are trying to assess the patient, it's always good to start with our vital signs. Assess for the patient's, the temperature, the pulse, the respiratory rate, blood pressure, heart rate, and of course their pain level. After we get that, it's always good to get their past medical history to make sure that to get an idea what their baseline is, and also if the treatments that they're undergoing is working for them or not. It's always good to ask them about their allergy status. Some patients, believe it or not, they forget from time to time what they're allergic to, or they just cannot recall everything they're allergic to. So every time we ask them for their allergies is good to prevent any medication errors or just for the overall safety of the patient. Also, we want to ensure that we understand the signs and symptoms of the patients that have hypertension. As discussed earlier in this presentation, in the written part, we want to make sure that we want to check for patients that have that complain from headache, dizziness, any blur vision, or any increased urinary output, because remember the hypertension affects all those organs, right? Affects the brain, affects the kidneys, affects the eyes, and affects the vasculature overall. When we're planning something for the patient or doing a care plan for them, it's always good to ensure that what we're trying to achieve is that the patient remains or their blood pressure is decreased over time. So either they maintain it at a certain level that is not about the hypertensive state, or that if they are in the hypertensive state, that we are actually bringing them down gradually. Okay. Also, we want to teach the patient about how to take their own blood pressure. This doesn't mean that the patient needs to do it manually that we do, or they can just go to shoppers, or a lot of them will have an automatic blood pressure machine that they just press a button and then they get their blood pressure, right? So it's always good to encourage them to have a record of their blood pressure on a daily basis, because that will tell us a lot about what might be causing or the high blood pressure, what might be exacerbating it, or if treatment is actually being effective or not. So encouraging the patient to keep a record is very important for the patient and also for us as healthcare professionals. We want to make sure that the patient understands the medications that they are in. High blood pressure, there's tons of medications are used for high blood pressure. You have your diuretics, you have your calcium channel blockers, you have your renin, angiotensin, aldosterone system drugs. You also have your beta blockers, and you have your direct vasodilators. So to explain to the patient in a general term, how each medication works, it's actually it helps them understand a little bit more about their condition and how each medication works for them and what side effects to expect. We are not going to explain to them, for example, like we learn in school, right? Detailed detailed pathophysiology of it. However, as nurses, we should have a skill to advocate for them and also to explain, to simplify things for them. And that's a very important thing for us to do. When we are implementing all the plan that we have created for the patient, or that we have worked together with the team to create this for the patient, we want to ensure that how their stress management is going. Because stress is very closely related to hypertension. It stimulates the sympathetic nervous system, making the heartbeat faster and increasing your blood pressure. We want to maybe advise the patient, for any diet consultation, visit a dietitian. He or she might suggest which are good foods for the patient to eat, any fat restrictions, any low sodium intake, and they can work all those things up with the patient, which is great. Last but not least, we want to ensure that the patient they have a realistic, basically, weight management and weight reduction program. A lot of times it's easy for us or for another person to just implement or create an intervention for a patient that consisting of weight reduction. But as a lot of people have experienced, weight reduction is not the easiest thing to do. So we have to understand the patient's perspective and also respect their autonomy, how they're coping with it, and perhaps just work around it as opposed to have the patient adjust to our schedule or adjust to the things that we need to do or the plans that we create for the patient. We should be pretty much creating plans or implementations that work around the patient and what's best for the patient. When we're evaluating the outcomes, we want to ensure we always check vital signs, because that will tell us if the treatment has been working properly or if there is anything else that we could do for the patient. We check their blood pressure record to see any trends. Maybe what time of the day the blood pressure is higher, any activities that makes it even worse, signs and symptoms that the patient is concerned or complaining about. We also want to evaluate the patient's BMI because that will closely relate to the patient's weight management, right? For patients that are obese or have hypertension, it would be unrealistic for us to actually expect them to come down to a normal BMI. However, if the patient can decrease their BMI, decrease their weight, and decrease their blood pressure, even a small amount or something substantially, it's actually a big improvement, and believe it or not, it's actually beneficial for the patient. We want to of course, do our health assessment. We want to be feeling those pulses for the rate, if it's regular, irregular. We want to make sure if it's bounding or thready, the pulses. For sure, for headaches or dizziness or things like that, we want to make sure we do our neurological assessment, which it's a very complex system, right? We want to make sure we include our cranial nerve, especially if the patient has any kind of retinopathy, right? So just review all your health assessment, your neurological assessment, cardiovascular assessment. The respiratory assessment is always important for patients that have hypertension, because the last thing we want is for the patient to have developed, for example, CHF due to hypertension, and that they're having cor pulmonale, right? Pulmonary hypertension, which is never good news. So we want to assess the patient, how they're coping with their stress, how they're coping with daily life, if their diet is working for them, if they are seeing an increase in appetite, decrease in appetite, and we want to ensure that we assess a patient for their medication, if it's working for them, if the side effects are more than the benefits, all the things that we have to work around with the patient to make sure that they stick to the regimen that we prescribe to the patient. And that's pretty much nursing implementation in a nutshell for hypertension. Hope you guys learned something from this. Okay, thank you for listening.